Hi, and welcome to Pharmtoberfest. The University of Georgia College of Pharmacy celebrates the week of Pharmtoberfest every year during American Pharmacist Month. And today we're interviewing pharmacists who play different roles in the health of our community. We are very, very lucky to have Dr. Ashley Hannings, who is a community pharmacist specializing in ambulatory care and is our expert in immunizations here at the College of Pharmacy. Hello, Dr. Hannings.
Hello, thank you for having me.
Thank you. The first question we want to ask is, why do you think it is important to celebrate American Pharmacist Month?
I think it's important for pharmacists and student pharmacists to have the opportunity to showcase what all we can do as a profession. While our profession has progressed a lot over the last several years as far as services that we can provide, many people still have a limited view of what pharmacists can actually provide. Just because they don't really see all of that in their day-to-day lives. So having a special month dedicated to this effort gives us the opportunity to educate the public on what we can provide and how we can help them improve their health.
Well, we know that you know everything there is about immunizations. And so, what immunization stigmas do pharmacists play a key role in breaking?
So there are a lot of stigmas and myths out there, from the flu shot gave me the flu to certain vaccines cause autism, to concerns about specific ingredients that are sometimes used in vaccines. A lot of those stigmas and myths stem from misinformation that's out there. You know, with the internet age, information is really accessible, but it's not always accurate. And so pharmacists are very knowledgeable in this particular area and can really help in breaking down those barriers and providing patients with accurate information to fight against some of those myths.
In terms of immunizations, how can pharmacists help the community?
I think one of the main things is access. So with vaccinations, you can go in several pharmacy settings and easily get an immunization. And for some of them, you don't even need a prescription, such as the flu, pneumococcal, meningococcal, and the shingles vaccine as well. And so really, pharmacists providing immunizations just provides patients with more opportunities to get vaccinated, and makes it as easy as possible. In addition to going into pharmacy settings, many pharmacists are active in the community, and will contract with employers, or bring those services to community centers and various other settings to really increase opportunities that patients have to get immunized.
Well, thank you, Dr. Hannings. We are very grateful for your service to the community, and happy American Pharmacist Month.
Thank you, you too.
Thank you, Dr. Hannings. We will now be transitioning into talking about a COVID-19 vaccine candidate.
So what is COVID-19? Coronaviruses are a family of viruses. They can cause symptoms that can be mild, such as the common cold, to more severe symptoms like severe or acute respiratory syndrome, SARS. The COVID-19 is a disease that was mutated from the virus of a known SARS virus, the coronavirus 2. Symptoms include fever, dry cough, loss of taste or smell, difficulty breathing, and even death.
So why don't we have a vaccine yet? You see all over the news that we've been studying the COVID-19, but we don't have a vaccine yet. It's because in order to get a vaccine approved, we have to go through a long, arduous process. These include 3 different phases of trials. So these trials make sure that they're safe and they work, how much we should give them, and then also any the efficacy of it, side effects, or any adverse reaction. The current vaccine that we were talking about today is in a phase 3 trial, so it's already on that, and they're just right now working to see if there are any adverse reactions to it.
And there are a lot of candidate vaccines out. One prominent one that's out right now is being performed by Sinovac Life Sciences. And like Stephen said, this vaccine is already in phase 3, so they're already testing on a lot of clinical patients. And what Sinovac is doing is they're using an inactivated or killed version of the virus to elicit an immune response. And although it's still pretty early, the vaccine has developed neutralizing antibodies in over 90% of the inoculated participants. The vaccine is going to be a 2-dose series separated by a 14-day interval. And the experiment that they're performing is a double-blind, randomized, placebo-controlled study. So neither the healthcare professionals that are administering the vaccine nor the subjects know whether they're receiving a placebo or a candidate. And Sinovac is expected to complete this study in September of 2021.
Those who are eligible for the vaccine are those who are over the age of 18 and are willing to be monitored for a 12-month period. Exclusions for the vaccine are people who are pregnant, have a history of SARS from coronavirus exposure, and those who are alcohol or have drug abuse.
So for this experiment's desired outcomes, the primary outcome measures incidence of COVID-19 7 days after immunization, adverse effects 7 days after immunization. For the secondary outcome measures, they're measuring incidence of disease 14 days after both first and second doses, the incidence of the disease up to 12 months after the immunization, and then the frequency of adverse effects 28 days after immunization.